FGFR stands for Fibroblast growth factor receptor, and there's several of them, and they tend to contribute to growth of the lung cancer cells. And particularly it looks like in squamous cell cancers, which really have been an under-researched area that I think is becoming more and more of a focus. So we've been really good, not where we need to be by any means, but have greatly improved the treatments for patients with lung adenocarcinoma. There's particularly good treatments such as chemotherapy agents like pemetrexed and bevacizumab, and we've discovered these actionable mutations and gene changes within the tumor. For example, patients with EGFR activating mutations can often have a very good response and do great on erlotinib for a good period of time, as well as patients with ALK translocations, and now we're discovering more and more ROS1 translocations. But squamous cell lung cancer there's been a renewed interest over the past several years, and there's been some great research in terms of taking a look at the genetic makeup of those tumors. And within that, one of the things that they've discovered that these fibroblast growth factor receptors can sometimes be mutated or amplified in squamous cell lung cancer. And there are several clinical trials and several drugs now that are moving through focusing on squamous cell cancer with those FGFR mutations and amplifications. And I think it's still early to see if they're going to be effective agents, but I think that there's signals, especially preclinically, that they could be. And I think in terms of who will benefit, it most likely will be in that squamous cell population of folks, and it's probably going to be more and more looking at and saying, hey, does this FGFR amplification play a role? Is that a biomarker? FGFR mutations. It was presented here by Dr. Hammerman that even a head and neck patient who had an FGFR mutation responded to a drug, pazopanib, which is approved for treatment of renal cell carcinoma that has some FGFR inhibitory activity. So there's really some exciting signals that they could be beneficial in those patients. So it'll be exciting to see how that plays out.